Introduction to Pharmacogenetics, Personalizing Medicine Through Genes. Pharmacogenetics, often abbreviated as PGX, is the study of how your genes affect your response to drugs. This field helps us understand why different people respond differently to the same medication. Pharmacogenetics is a rapidly advancing field that combines genomics and pharmacology to create personalized treatment plans tailored to an individual's unique genetic makeup. Instead of a one-size-fits-all approach to medication, pharmacogenetics aims to ensure you get the right drug at the optimal dose, tailored specifically to your unique genetic profile. This personalized approach can significantly improve treatment outcomes while reducing adverse drug reactions. Advancements in technology like next-generation sequencing, or NGS, are making genetic testing more accessible and effective. These sequencers can rapidly analyze your DNA at a fraction of the cost compared to just a decade ago. Additionally, artificial intelligence systems are now able to analyze complex genetic data and predict how individual patients might respond to various medications. The global pharmacogenomics market is experiencing substantial growth, reflecting its increasing importance in modern medicine. Currently valued at $8.5 billion in 2023, it is projected to reach $18.1 billion by 2032. This growth is driven by increasing demand for personalized medicine, advancements in genetic testing technologies, and greater integration of pharmacogenetic data in healthcare systems. This has been an introduction to pharmacogenetics and how it's transforming healthcare through personalized medicine. Next, we'll explore the key concepts and real-world applications of pharmacogenetics, showing exactly how it works to improve patient outcomes. How does pharmacogenetics work? Let's dive into the key concepts and real-world examples that demonstrate how genetic variations influence medication responses. Individuals respond differently to medications due to genetic variations that influence how their bodies process drugs. Even small changes in our DNA sequence can significantly alter drug metabolism and effectiveness. These genetic variations affect two key processes: pharmacokinetics, how the body processes drugs, and pharmacodynamics, how drugs interact with their targets. Pharmacokinetics includes how drugs are absorbed, distributed, metabolized, and eliminated. Genetic variations can affect how quickly enzymes break down drugs, potentially leading to higher or lower drug concentrations than expected. Pharmacodynamics concerns how drugs interact with their targets at the molecular level. Genetic variations can alter these targets, affecting how well drugs work for different individuals. Let's look at some real-world examples of how specific genetic variations affect drug response. Variations in the CYP2C19 gene can affect how well clopidogrel, a common antiplatelet drug, works. This gene produces an enzyme that converts clopidogrel to its active form. Some genetic variants result in slower metabolism, reducing the drug's effectiveness and increasing the risk of cardiovascular events. Similarly, variations in the DPYD gene can impact the metabolism of chemotherapy drugs like fluorouracil. The DPYD gene produces an enzyme that breaks down fluorouracil. Patients with certain DPYD variants process these drugs more slowly, potentially leading to severe or even fatal toxic reactions at standard doses. Pharmacogenomic testing analyzes a patient's DNA to identify genetic variants that may affect drug response. This can be done using a simple blood or saliva sample. The results help doctors make informed decisions about which medications to prescribe and at what doses. The benefits of pharmacogenetic testing include personalized drug selection, optimized dosing, fewer adverse reactions, and improved treatment outcomes. Interestingly, the frequency of these genetic variants varies across different populations. This graph shows comparative analysis of pharmacogene frequencies across Arab populations alongside reference populations. These differences explain why medication responses can vary between ethnic groups, highlighting the importance of considering ancestry in pharmacogenetic approaches. Studies have shown that personalized drug regimens based on genetic data lead to better treatment outcomes and fewer side effects. This is particularly evident in areas like chemotherapy, cardiovascular disease, and psychiatric medications. It's estimated that over 90% of individuals carry at least one actionable genetic variant that could inform prescribing decisions. This widespread prevalence of significant genetic variations highlights why pharmacogenetics is poised to revolutionize healthcare.